As a psychiatrist, one of the most common questions I get about Effexor, also known as venlafaxine, is what kind of side effects will I have with this medication? What people never ask about though is how hard is it to get off this medication? Because this is where things can get really hard and complicated. Hi, I'm Dr. Air, integrative psychiatrist and lifestyle physician. Today we're talking about Effexor, how it works, why it helps so many people with anxiety and depression, and the one thing you absolutely need to know before you start taking it. Stick around because I'm going to show you what's happening in your brain when you take this medication and why stopping it requires a strategy most doctors don't explain. Quick story about Michael. His anxiety started about 2 years ago. He was 46 at the time, high pressure job, 2 teenage daughters, aging parents who both live with him. For months, his anxiety had been relentless. Racing thoughts at 3 a.m., chest tightness during meetings, a constant feeling that something bad was about to happen. He tried therapy, he tried meditation apps, he cut out caffeine. None of this helped. His primary doctor prescribed Effexor. Within 5 weeks, Michael felt like he could breathe again. The constant hum of dread, gone. The racing thoughts, quieter. But this was 2 years ago, when he had lots of stressors. Things have, however, been stable lately, and he decided it was time to stop Effexor. That's when things got rough. So let's talk about what Effexor actually is and why it works so well for anxiety and depression. Effexor, or venlafaxine, is an SNRI. That stands for serotonin norepinephrine reuptake inhibitor. Think of your brain like a busy city with millions of messages being sent every second. These messages travel between brain cells using chemical messengers called neurotransmitters. Two of the most important ones for anxiety and depression are serotonin and norepinephrine. Serotonin helps regulate mood, sleep, and emotional balance. Norepinephrine affects alertness, focus, and your body's stress response. When you're anxious or depressed, these chemicals get swept away too quickly before they can deliver their calming message. Effexor blocks that sweep away process. It keeps serotonin and norepinephrine in the space between your brain cells longer, so the calming signal has time to be delivered. And that's why it works. Effexor is FDA approved for depression, generalized anxiety disorder, social anxiety disorder, and panic disorder. And clinically, it's an effective medication for treating these conditions. One study found that Effexor significantly reduced anxiety symptoms in over 60% of patients within 8 weeks. So for people whose anxiety shows up as racing thoughts, chest tightness, or that feeling of impending doom, Effexor can be life-changing. But here's the thing most people don't realize. Effexor doesn't work overnight. Most people notice some improvement after about 2 weeks, maybe better sleep, less tension. But the full anxiety effect, that takes 4 to 6 weeks. This isn't because the medication is weak. It's because Effexor doesn't just change chemical levels. It actually helps rewire your brain's network connections. Studies show that medications like Effexor promote neuroplasticity, your brain's ability to form new, healthier connections. That process takes time, like rehabilitating a muscle after an injury. So if you're 2 weeks in and thinking, this isn't working, give it some time. Now let's talk about side effects, because you've probably heard some horror stories online. Here's what the research actually shows. The most common side effects in the first 1 to 2 weeks include nausea, headaches, fatigue, and sometimes trouble sleeping. Most of these resolve as your body adjusts. This is why I tell my patients, don't judge the medication by how you feel in the first week. But there are 2 side effects that deserve more attention. The first side effect is sexual dysfunction. Studies show that about 30 to 50% of people on SNRIs like Effexor report changes in sexual function, reduced desire, difficulty with arousal, or trouble reaching orgasm. For many adults, especially those navigating midlife, relationship strain, or hormonal shifts, this can feel like one more thing being taken away. I've had patients tell me, the anxiety is better, but now I don't feel like myself in other ways. This is a real trade-off, and it's worth discussing with your doctor. Sometimes adjusting the dose helps. Sometimes adding another medication can counteract it. Sometimes switching to a different class of medication is the answer. The second side effect is weight gain. Effexor is associated with a low to moderate risk of weight gain compared to other antidepressants. Most people gain only a few pounds over 6 to 24 months, if any. One study found average weight gains of about 3 to 4 pounds over 2 years. But here's the catch. About 40% of people may gain 70% or more of their baseline body weight with long-term use. Why does this happen? Effexor can increase cravings for carbohydrates and sugary foods. It can cause fatigue, which reduces physical activity, and it may slow down your metabolism slightly. This becomes more common as we get older, especially when you're already dealing with metabolic changes from chronic stress or hormonal shifts. But weight gain from Effexor is not universal. Many people don't gain any weight at all. Now, here's the part most doctors don't spend enough time explaining. Getting off Effexor can be really hard. Effexor has one of the shortest half-lives of any antidepressants. This means it leaves your system quickly. Miss a dose by even a few hours and you might feel it. Stopping Effexor is like pulling out the blocks in Jenga. You have to do it slowly and carefully. When you try to stop this medication, especially if you stop too quickly, your brain has to readjust to functioning without it. And that readjustment can feel terrible. People describe brain zaps, electric shock-like sensations in the head, dizziness, nausea, flu-like symptoms, irritability, worsening anxiety. A study found that up to 78% of people experience withdrawal symptoms when stopping Effexor. Some describe it as worse than coming off all the medications they've taken. One patient told me, "I felt like I was dying. The brain zaps were so intense I couldn't drive for weeks." Now, not everyone experiences this, but you need to know it's a possibility. So what's the right way to stop Effexor? Just like with Jenga, carefully, slowly, gradually, under medical supervision. For someone who's been on Effexor for several months or years, this might mean reducing the dose by small increments every 2 to 4 weeks. A study found that hyperbolic tapering, reducing by smaller percentages as the dose gets lower, resulted in significantly fewer withdrawal symptoms. This is not something you do on your own. Work with a psychiatrist who understands how to taper SNRI safely. And remember, the decision to stop should be made when you're stable, not in the middle of a crisis, and only following your mental health practitioner's recommendation. Now, I want to be clear. Effexor can be an incredibly effective tool for anxiety and depression. For many people, it's life-changing, but it works best when it's part of a bigger picture. Therapy, especially cognitive behavioral therapy, can enhance the effectiveness of Effexor by up to 30%. Movement, just 30 minutes of moderate exercise 3 times a week, significantly boosts medication effectiveness. And sleep is absolutely critical. When you're not sleeping well, your brain can't regulate anxiety effectively, no matter what medication you're on. Quality sleep helps your brain process stress, balance neurotransmitters, and recover from the day. If you're struggling with sleep and anxiety, I've created a free sleep guide that walks you through the exact strategies I use with my patients to improve sleep quality naturally. You can download this for free in the description below. Anti-inflammatory nutrition and stress management practices also support your brain's ability to heal. Effexor isn't a magic bullet. It's a tool that works best when combined with lifestyle strategies that address the root causes of anxiety. Michael, the patient I told you about earlier, he stayed on Effexor for 3 years. It gave him the stability he needed to rebuild his life, to start therapy, to set boundaries at work, to prioritize sleep and other lifestyle tenets. When he was ready to come off it, we tapered slowly over 6 months. He had some mild dizziness for a few weeks, but nothing like the horror stories he'd read online. Today, he's off medication and managing his anxiety with therapy, exercise, and targeted supplements. And if you want to understand the root causes of anxiety that medications alone can't fix, like inflammation, blood sugar dysregulation, and nervous system overload, check out this next video where I break down the biology of anxiety that most doctors never explain.